I was I was part of the first promotion of certified application counselors through Access Health Connecticut back in the summer of 2013. And I was very lucky because last year I was part of the first broker academy. And like I said before, I'm very, I have a passion for health insurance. Today, I'm gonna talk about Husky programs, eligibility and benefits. The new, how can I get rid of this? Because this is not, I have something that doesn't allow me to see what you are seeing. And I gotta get rid of it. Can you see that? Okay, it does not matter. So today I'm going to talk about the Husky programs, eligibility and benefits, the new Husky eligibility for non-citizens individuals, Cover Connecticut program, and the Medicaid unwinding. Access Health Connecticut enrollment and qualified health plans, premium tax credits, eligibility, and employer-sponsored insurance. Okay. Access Health Connecticut. What is Access Health Connecticut? Access Health Connecticut is the Connecticut official health insurance marketplace where Connecticut residents can shop, compare, and enroll in a qualified health plan or a standalone dental health plan. Medicaid programs such as Husky A, B, and D. It's also the only place in Connecticut where individuals, families, and small businesses can get assistance with the cost of health coverage if they qualify for advanced premium tax credits. So, like I said before, Access Health Connecticut is the marketplace to buy insurance. So people that want to apply for Husky have to go to Access Health Connecticut. Then we have private insurance companies like Connecticut Insurance Company, Inc., Anthem, and Connecticut Benefits, Inc. What is Husky Insurance? Husky Health Insurance is the state of Connecticut's public health coverage program for eligible children, parents, relative caregivers, elders, individuals with disabilities, adults without dependent children, and pregnant women. Husky has 4 plans, which is Husky A, B, C, and D. Let's talk about all of these Huskies. Husky A is for children under 19, for their parents or relative caregivers, pregnant women. They all can be eligible for Husky A, also non-Medicaid, and that is depending on their income. Husky B is for children, only for children under 19, uninsured children under 19 that have a higher income household may be eligible for Husky B, also known as Children Health Insurance Program or CHIP, and that is depending on a specific income level. So depending on the income level, it can have a cost sharing. Now we have Husky C. Husky C is for people who are 65 and older, blind or disabled, Connecticut residents aged 65 or older, or who are aged 18 through 64, and who are blind or who have another disability may qualify for coverage under Husky C, also known as Medicaid for aged blind and disabled, or Title 19. And finally, we have Husky D, which is for low-income adults aged 19 through 64. Connecticut residents aged 19 through 64 who do not qualify for Husky A, who do not qualify for federal supplemental Social Security income or Medicare, and who are not pregnant may qualify for Husky D, also known as Medicaid for low-income adults. Now, Husky C, people that are eligible for Husky C have to apply through the Department of Social Services or DSS. The rest of the plans, Husky A, B, and D, have to apply through Access Health Connecticut. I'm going to talk about immigration status and eligibility for health coverage. These are the most common status. So, of course, American citizens are eligible to get health coverage. Lawful permanent residents or green card holders, people that have employment authorization card, asylees, refugees, conditional entrant granted before 1980, battered non-citizens, spouses, children, or parents, victims of trafficking and his or her spouse, child, siblings, or parents, or member of a federally recognized Indian tribe or American Indian born in Canada. Citizens of the Marshall Islands, Micronesia, and Palau, who are living in one of the US states or territories. I would like to point out and talk about DACA recipients. The Deferred Action for Childhood Arrivals. Unfortunately, they are not eligible. They are not eligible for Husky. They are not eligible to buy insurance with advanced premium tax credits, and they are not eligible to apply through Access Health Connecticut. They are eligible to apply, if they want to buy insurance through a private company, they can do that. They can have insurance through a job, but unfortunately, they are not eligible to apply through Access Connecticut. For more information, you can go to accesshealthconnecticutct.com and you can get more information about it. Everybody is very excited about the new eligibility for non-citizens individuals. Okay. Effective January 1st, 2023, children aged from 0 to 13 with no immigration status are eligible for state Husky A and B. This is something that it's amazing. I mean, I couldn't believe it. I have been working doing health insurance, like I said before, for over 22 years, and I never saw such a thing. I'm thrilled with it. So, yeah. So children that have health insurance that are enrolled in Husky only for 1 day can have Husky until the age of, until they turn 19. So they have Husky for 1 day, they move to another state, they move to another country, they come back when they are 15. That child is eligible to apply for Husky A or B. Husky B prenatal care and postpartum. This is a law that was effective last year on April 1st. And it's for pregnant women with no immigration status. So these women were eligible to have Husky coverage through their pregnancy. It was like kind of misunderstanding about the postpartum, including myself at the beginning when this law was implemented. Many people thought that they were eligible also for postpartum, but they were not. The postpartum extension was for people that were eligible already for Husky postpartum, and it was extended from 2 months to 12 months. Now, yesterday, I got a policy transmittal from the Connecticut Medical Assistance Program saying that a new eligibility group is going to be effective on April 1st, which is in a few days. So this new law is postpartum care for non-citizens. Now, I'm going to read exactly what I read, what it is in the policy transmitter, okay? So it says, this new coverage group will provide 12 months of postpartum care to recently pregnant individuals who do not qualify for Medicaid due to their immigration status, those who qualify for Husky B prenatal care group. So that is what we are talking about. That is the pregnant women that were eligible last year, but they were eligible just for during their pregnancy. So this new coverage, it also allows postpartum coverage for individuals whose pregnancy ended prior April 1st, 2023, but who are within the 12-month postpartum period. Coverage will end on the last day of the month that their 12-month postpartum period ends. Now, because I just got this yesterday, I didn't have the opportunity to talk to anybody about what this law, I know what this law means. It means that pregnant women with no immigration status are going to be eligible for a 12-month postpartum now. But if you see here, when it says the new coverage, it also allows postpartum coverage for individuals whose pregnancy ended prior to April 1st, 2023, it makes me think that the coverage can be retroactive back, but I am not sure about it. Now, I would like to talk about the Covered Connecticut program. Many people are not familiar with it, and I would like to explain a little bit about it. The Covered Connecticut program is administered by the Connecticut Department of Social Services, and it provides health insurance coverage, dental coverage, and non-emergency transportation to qualifying Connecticut residents between ages 18 and 64. The state of Connecticut pays the customer portion of the monthly payment, which is the premium, directly to their insurance company, which can be Anthem, Connecticut Benefits, Inc., and Connecticut Insurance Company, Inc., and also pays for deductibles, co-pays, co-insurance, and maximum out-of-pocket that customers would typically have to pay with a health insurance plan. So even though consumers have a private insurance, they also have Husky benefits, which is the dental coverage and the non-emergency medical transportation. So to qualify for the Covered Connecticut program, Connecticut residents must have a household income up to and including 175% of the federal poverty level, and be ineligible for Husky Health Medicaid due to their income. Be eligible for financial help to purchase a health insurance on the Connecticut Insurance Exchange, which is Access Health Connecticut, using 100% of available advanced premium tax credits and cost sharing reductions. They must enroll in a silver level plan on the Connecticut Exchange. People that are eligible for the Connecticut program, they are eligible and all year round, okay? So if they are in the 175% income limits, even though they are gonna purchase a qualified health plan, they don't have to wait until they open enrollment. Here, you have a Husky income guidelines. I'm not gonna go through it because, it's too much information. I highly recommend you to have it handy. It's gonna help you. It's gonna help you when the time comes to know who is eligible for Husky A, Husky D, or pregnant women, or any kind of levels of Husky B. Here, I also included the income guidelines for Covered Connecticut. That 175% increase can be a lot. So let me go back to, if we go here to a family of 4, right? The household income it cannot be more than $48,000 per year. So if they are under this income, mom, dad, and children are eligible for Husky A. But if they are a little over income, and if they go to 52,500, they are gonna have coverage through Covered Connecticut. So the bottom line is that they don't have to pay anything, and they have kind of the same benefits as Husky. Now, I'm going to talk about end of the public health emergency and the Medicaid unwinding. We are going to enter in a period that it can be a little bumpy. So let's talk about the unwinding and what it is, right? So when the public health emergency was declared in 2020, Connecticut extended Husky health coverage to most of Husky members to help deal with the COVID-19 pandemic. It has been announced that the public health emergency will end on March 11th of this year, and the continuous coverage requirement expires tomorrow. So, transitioning from Medicaid cheap to the marketplace, like I said before, it can be a little bumpy. So, the unwinding, it's going to take DSS a year to do the complete unwinding. They are saying that it's going to be from April of this year to April of next year. Cases are going to be based on case by case, and some people may still be eligible for Husky. So people shouldn't be afraid of the unwinding, okay? Sometimes when the income, it's a little higher for clients. Let's say last year, the income was a little lower than this year, let's say, because you got a raise in your job, or maybe, I don't know, you were doing some overtime, whatever it may be. So clients can be eligible for a transitional medical assistance, and that is usually income coming from work. So the state gives you that year, just in case, income changes. People can be eligible for Cover Connecticut. And if they don't, they can qualify for a qualified health plan with advanced premium tax credits. Now, a person who is determined eligible for the marketplace, right, and eligible to buy a qualified health plan, they have 60-day open window to choose a qualified health plan and 30 days to send Access Health Connecticut the required information. Of course, there is a risk of people losing coverage due to the unwinding. People may not receive the renewal notice. If they receive it, maybe they don't understand it because they may have done it a couple months ago and they may say, oh, I just did it. Why they are sending me another renewal notice? They may not submit information on time. Some people will reapply, leading to additional work for agencies and gaps in coverage. And some people may not learn that they have lost coverage in time to act. Here, there are some steps that we can take to support our clients during the Medicaid unwinding. It is crucial that we educate clients about what is going to happen with the Medicaid unwinding. We need to ask people to update their contact information depending on, if they are eligible through Access Health Connecticut or DSS. But in this case, for Husky A, B, and D, or a qualified health plan, we are going to do all the updates through Access Health Connecticut. So people shouldn't be afraid to do changes. And I would like to point out that people that have done updates on their applications, what probably happened is that they're going to get Husky extended because they already did the updates. So people that didn't do the updates need to do it, okay? So please help people to update their contact information, complete their renewals and applications. Husky A, B, and D members can do the updates, as I said before, through accesshealthconnecticut.com or by calling 855-805-4325. Husky C members can make updates through mydss.ct.gov or calling 855-626-6632. Certified application counselors like myself and many others that we have in the community can assist one-on-one clients, and that should be free of charge. Now, what do you need to complete an application? Have this information for yourself and anyone in your household when applying for health coverage. Okay, when we talk about a household, we talk about mom, dad, and children. Many of our clients live with uncles, nieces, nephews, grandparents. Those are not considered household members. Okay, I know we all live together, but to apply for health coverage, Your household is mom, dad, and your children. You should have the dates of birth, social security numbers, individual taxpayer identification number or ITIN, visa, green card, or immigration documents, most recent Form W-2 or Form 1040 or Form 1089, current insurance coverage if you have one, pay stubs, profit and loss statements, and other employment information to confirm your income for everyone in your household. Now, please, when we have a family that have children under 13, please, if you have the date of birth, you have their address, just the information of the household. If you don't have the exact numbers of your current income, please don't worry, just put these children into the system because the clock is ticking for them and we don't want them to lose the opportunity to get Husky, okay? We put these children in the system, we do the application, and later on, maybe tomorrow, after tomorrow, we can upload all the information that is required, okay? But let's be very careful with these children. We don't want them to lose the opportunity to get Husky. I'm going to talk about open enrollment for 2024. Husky and Access Health Connecticut open enrollment. For Husky A, B, and C, the open enrollment is all year round. Renewals have to be done every year. Some people choose to renew it automatically for 5 years. And so the system is going to do it automatically, checking information with the IRS and other systems that are connected with Access Health Connecticut for their eligibility. But anyway, the most important thing is to know that all these Huskies are eligible. They don't have an open enrollment. There is an open enrollment for qualified health plans and standalone dental plans. And that is going to be November 1st of 2023, and coverage is going to start in January 1st of next year. Renewals are done every year unless you choose the automatic renewal option that it can go up to 5 years. I strongly recommend to review your plan every year because you want to make sure that it has the coverage you need and the price you can afford. Insurance companies change the coverage and the prices every year. So highly recommended to review your plan every year. There are exceptions to the enrollment period, okay? And that we call it qualified life changing events. Here I'm showing some common qualifying life events. Getting married or divorced, changing income, permanently moving to another state, having or adopting a child, and losing health care. I just want to reinforce again, okay? Husky is, the open enrollment is all year round. Okay, let's talk about premium tax credits and what it is, right? During open enrollment, people can apply for a qualified health plan, and they may be able to get premium tax credits, which is assistance with the cost of healthcare coverage. If you qualify for advanced premium tax credits, They are available to households whose modified adjusted income is below 400% of the federal poverty level, cannot be eligible for qualifying affordable health care coverage, Medicaid, CHIP, VA care, Medicare, TRICARE, and employer-sponsored insurance, which I'm going to talk a little more in a minute. Must file taxes for the year in which you receive advanced premium tax credits for the premium tax credits, including filing IRS Form 862, which is proof of eligibility for financial assistance. Must be a resident of Connecticut, must be a US citizen or lawfully present. And also, if you are married, you must file jointly with your spouse to receive advanced premium tax credits. Individuals who are eligible for employer-sponsored insurance, they are determined eligible for Husky A or D on the household income, may choose to enroll in Husky Health coverage. So they can have employer coverage and Husky. A and D only. Individuals who are eligible for coverage through his employer is typically not eligible for advanced premium tax credits. And I'm gonna tell you why. The employer's coverage, they have to be affordable and meet the minimum value standards. What is affordable? Affordable when employer-sponsored insurance is affordable for employee if the employee contribution for self-only coverage is up to 9.12% of the household income. It is also considered affordable the spouse and dependents if the employee contribution for family coverage is also up to 9.12% household income. So to meet the minimum value, a health plan meets the minimum value standards if it pays at least 60% of the total cost of the medical services, including substantial coverage for physical and inpatient hospital services. If the employer coverage is considered affordable and meets the minimum value standard, you are not eligible to get it with access with APTCs or advanced premium tax credit, but you can still enroll, but without any type of assistance. So the bottom line is that usually, and in my experience, I can count the people that are offered insurance through their jobs that are eligible to have insurance through Access Health Connecticut with APTCs. Here, I have some Husky benefits overview. So as you can see, it is a very good coverage. It has preventive care, doctor visits, women's health care, maternity care. I'm not going to go over that. And also, we are going to be sending you, let's see if I can open this summary of, no, I'm not going to be able, can I do this? Let's see if I can open this. Anyway, it is a summary of benefits that it's going to be very handy for you guys. It's going to be all the eligibility for Husky A, Husky B, and Husky D. Oh, here we go. So as you can see here, you see Husky A, C, and D, Husky B band 1, and Husky B band 2. I didn't mention anything about Husky B band 1 and 2. Depending on the income levels, Husky B band 1 has no premium. And yes, and when people go to the doctor, they may have some type of co-payment, but it's very minimum. But when the income is a little higher, then they go to band 2. And I'm gonna remind you that is only for children, okay? Husky B is only for children. So the level 2, then you have to pay $30 for one child, and if you have 2 or more, is $50 per month a premium, and then you are gonna have to pay some copay. Now, before I mention that Husky A and D you can be enrolled in Husky A and D and have employer coverage. But you cannot have a child enrolled in Husky B if you have insurance through your employer. So let's go back. I'm gonna go back here. Let me close this and go back. So, and now, here you can see qualified health plans, essential health benefits. Those are the minimum requirements for all qualified health plans. It does not matter that it's a bronze, is a silver, gold, or platinum plans. These are minimum requirements that the government require to all plans in this change. Here, I put some telephone numbers and websites that can be useful for you. And with this is the end of the presentation. I thank you so very much for attending, and I'm open to questions now.
Thanks, Maria. We had a couple questions in the chat that came in the past few minutes. So I'll start by reading those questions. The first one was, Jennifer asked, how can a family find a certified application counselor to assist with a Husky C application? Is there a list or resource available statewide?
Let me see if I understand it correctly. Your question is how? Repeat the question, because I didn't quite.
Asked how a family can find a certified application counselor to assist with a Husky C application, and wants to know if there's a list or resource available statewide. And Jennifer, you're welcome to jump in too if you'd like to clarify further.
Yeah, I can answer that question. If you go to Access Health CT, you can find all the certified application counselors, and you can find brokers through Access Health Connecticut, yes. And you have a complete list of them.
And that's even for Husky C?
It is for all. Oh, I'm sorry. You are talking about Husky C.
Yes, Husky C specifically.
No. I'm sorry. I didn't get the C. No. For Husky C, there are no application counselors.
Oh.
You have to go through the Department of Social Services. Yes, you cannot go through Access Health Connecticut. Sorry. Yeah.
Thank you.
Okay. Thank you. And Lily asked in the chat, can a family have private and state health insurance?
A family can have private and state health insurance, yes. They can have private through their job, and if the income qualifies them for Husky A or for Husky D, they can. they can have both. The private insurance is gonna be the primary insurance, and then Husky is gonna be the secondary insurance.
Okay, thank you. And then Anna asked, can you decline the insurance provided by your employer if you qualify for Husky?
Yes, you can. Yes, you can. Now, if you decline the insurance through your job, and you are not eligible for Husky, and you are eligible for a qualified health plan, you won't be eligible to get assistance, and you are going to have to pay for the price.
Got it. Thank you.
If I could elaborate on the question, Meg.
Absolutely.
Thank you so much. So I have a family of 4. Dad works at a fast food restaurant. He is a citizen, but his wife is not, and one of the children is not either. She qualifies for the new implementation for January 1st. And this little girl can get health insurance. Now, Husky told them that since the dad's job provides insurance, they should go to the private insurance instead of Husky, but they obviously cannot afford to pay every month for the 4 children. And so I don't know who to talk to and direct this family so this girl can get insurance and he doesn't have to pay out of pocket for private insurance that the job provides.
Okay, so I'm gonna ask you a few questions. So number 1, do you know if the income is under the Husky A income guidelines? Do you know that? Do you know that? Do you have that information?
Can you refresh what the income guidelines are?
Let's see if I can go. Let's see how am I gonna go here. Here we go. Okay. So you are talking about 4 people, right?
Yes.
If they make 48,000 a year, she may be eligible. She should be eligible for Husky A, but there is the way I see it, the way we are having this conversation, I can tell you right now, yes, she can be eligible. But if you want me to look into the case a little more, because I would like to get a little more information, so I can with the case. But I have to tell you that the way I see it right now, if they have that income, the girl should be, and if she is under 13, of course, the girl should be eligible for Husky. They don't have to get insurance through the employer. Now, if the income is a little higher and the girl doesn't qualify for A and qualifies for Husky B, then no, she's not eligible to get Husky B.
Okay. Your contact information will be in the presentation?
Yes. And you know, let me yes.
Thank you so much, Maria.
Okay, super.
And we will send that out to you in our
Yes,
follow-up
yes,
email.
and your name again?
Anna Rios.
Okay, Anna, yes. I'll be talking to you later on, okay?
Thank you so much, Maria.
Anytime.
And we have 2 more questions that I want to cover quickly in the chat before we wrap things up, and we may go a few minutes past 11. I know we were a couple minutes late to start, so if that's okay. But otherwise, we will send out the information covered in this presentation afterwards. Graciela, I don't know if you want to elaborate a little bit on the situation you mentioned in the chat, where you said a family who has 2 addresses, one for business to get private insurance in New York, and another one is a residence. They can get Husky in Connecticut.
Okay, where do they live? Do they live in and another is a resident. So they live in Connecticut.
Mm-hmm. It sounds like it.
They live in Connecticut.
Yes.
Okay, and they have the business in New York, and they have insurance in New York. Well, that is a kind of tricky question. I need to look into that specific case, because you're saying that they have insurance, private insurance in New York. So I guess if they live in Connecticut and if they are eligible again for Husky A, they may
They are eligible for Husky A, you said?
that is going to be based on income.
Okay.
Okay, because if they are not eligible for Husky A, remember, Husky A people can have private insurance through their jobs, and at the same time can have Husky. So the private insurance is going to be the primary, and Husky is going to be the secondary.
Okay.
Yeah,
Thank you.
But it has to be Husky A though.
Thank you so much.
Okay. That sounds like maybe that would be a question you could follow up with Maria on afterwards. I do want to quickly say before, or Tita, I don't know if you want to jump in here before, since it is now 11, if you do have to leave, I put the link in the chat to a survey that we'd love for everybody to take. It's just a couple questions. We'd love to know what you thought about this training and how you heard about it. Because we will be offering more trainings like this. This is also the link to our page for our Food for Thought campaign in Stanford, where we have other resources about Husky and SNAP. And we do also have an upcoming training similar to this one on SNAP that will be happening in on April 12th in English. And then we will have a separate training on April 25th, I believe, and that one will be hosted entirely in Spanish. And that's through our partnership with another organization in the state called End Hunger Connecticut. And so I'm putting both of those links to our flyers about those trainings in the chat that you are welcome to share with anyone. These are free and open to anyone. And the links to register, similar to the link for this one, are up on that Food for Thought page. And I do see there are two more questions in the chat. Maybe what we could do is we could chat about the answers to these questions and put answers to these questions in our follow-up email, since it is now 11:01.
Yeah, we can do that. Let me say something before we go that I didn't mention and I want to mention. The city of Stanford is working very closely with Building One Community and also the Board of Education. Okay, every Tuesday we are doing trainings at Building One Community. We assist parents to fill out application for their children, especially for the children with no immigration status. So we not only help them to fill out the application, but we are empowering them to learn about how to do it and then be able to do it next year and the years after that, all the renewals. So please, if you have families, please refer them to Building One Community so we can put them for the trainings that we have every Tuesday. And I don't know if, Meg, do you have the Building One Community number available?
Number available? I do not, but I do know that at least briefly I saw Bernadette from Building One Community on this call. I don't know if you're still there.
Yeah, there is a quote. I'm looking in the chat and it says no immigration. Yeah, okay, yeah.
Thanks, Tita. And we can put that in the follow-up email also.
Perfect.
Meg, was there any other questions, or are we going to try to address those in the follow-up email? I think there's still a few folks on. I think if
it looks like 2 more questions from Amber and Sina. If you are interested in staying on a couple extra minutes to talk about those questions, we are welcome. You're happy to stay on a couple extra minutes. And anybody else who needs to leave, you're welcome to leave. Thank you for coming. Amber's question was, what if someone was over 65 years old, was on Husky D in the past, and they didn't receive SSA benefits or Medicare? Would they remain on Husky D in that circumstance until they receive SSA benefits and Medicare?
Unfortunately, no. People over 65, they are not eligible to receive Husky D. They are eligible for Husky C. So yeah, probably. And now because of the unwinding Medicaid, they will lose. They will lose it, yes.
Okay, thank you. And actually, I just realized Lily also asked, are braces covered through Husky?
Braces coverage, dental coverage through Husky is, well, the bottom line, braces to cover braces Husky, the child has to have a very extreme problem, okay? It's not like cosmetic. No, they don't cover braces for cosmetic reasons. The dentist has to provide all the documentation saying, you know, no, it doesn't cover braces unless it's an extreme situation.
Okay, thank you. And then the last question was, if an individual is applying for Husky C and was denied for being over asset, what are the best steps in guiding the family to become eligible? The individual shared a bank account with the mother and did not have his own account. The SSI was being deposited into the mother's account and the assets were not separated and therefore caused the individual to be over asset.
Well, that's a tricky question. You are or you are not eligible. I mean, DSS can go after the assets. They can go back 5 years. So I don't know what to tell you. If they are not eligible, they are not eligible.
Sina, or
because here it says the SSI was being deposited. It does not matter that it's being deposited into the mother's account. It does not matter. Yeah. It does not matter. Yeah.
Okay. Oh, and then we have one more question in the chat. People who have lived in Connecticut for less than 5 years can apply for insurance?
Yes, they can. They may be eligible for Husky. All depends what they have. If they are asylees or refugees, they are going to be able to get Husky. If they are not, if they have a work permit, if they have a green card less than 5 years, if they have some type of visa, they can apply for a qualified health plan during open enrollment. Okay, or unless if a person arrives today with any of those status, yeah, they can apply. They can apply for coverage because that is an open special enrollment for them. They just arrived in the state of Connecticut, right? So otherwise they have to wait until the open enrollment if they don't have a special open enrollment, but yes.
Okay, thank you. And Martine is asking, can people who have political asylum apply for Husky?
Oh, yes, absolutely. They can apply for Husky. Now, let me let me say something. When we talk about, okay, can a person apply for Husky A, Husky B? Can a person who has asylum can apply for Husky? Okay, when we applied for health coverage in the state of Connecticut, we have to put all the information into the Access Health system, okay? And the system is going to give you what you are eligible for. A person cannot apply, okay, I'm gonna apply for Husky A, or no, it doesn't work like that. If you ask me if they are eligible for Husky A, yes, they are eligible, yeah.
Okay, thank you. And are there any other questions from anybody else? Well, thank you all for coming, and we'll send out all this information to everybody afterwards. And thank you for being, oh, one more question. DACA recipients eligible?
No, unfortunately, they are not. They are not. They are not eligible for Husky, any kind of Husky. They are not eligible to purchase a qualified health plan with assistance, and they are not eligible to apply through Access Health Connecticut, even if they want to pay full price. They can only buy it outside the marketplace. Yeah. When the Affordable Care Act was implemented, they mentioned these, the DACA recipients, and it says very clearly that they are not eligible for benefits. They are legally present here. They can work here, but they are not eligible for benefits.
And what about, can families who came with a tourist visa apply for Husky?
One, mom and dad, unless mom is pregnant, which the new law is going to apply, could be eligible. Otherwise, they are not eligible unless the children are under 13. Now, there are some type of visas, Each case is different, though, very different. Even though they may seem the same, it's completely different. So that should be, that is case by case. But if they come to the United States and they are planning on staying in the state of Connecticut, I don't know. I don't know. I highly recommend people with that status. If you are assisting people that have that type of status, just do the application and see. Just do the application and see what result you get from the system.
Okay, thank you. And one more question: if a person is applying for their citizenship, can they apply for Husky?
Yes, it doesn't affect them at all. Yes.
Okay, thank you. So thank you all for bearing with us at the beginning and with our later start and hanging with us until the end. We'll send this information out in our follow-up email along with the resources that Maria shared. But thank you all for joining us today.
Thank you.
Thank you, everyone.
Thank you, Maria.
Thank you.
Thank you, Maria.
All right. We'll end the meeting now. Goodbye, everyone. Have a good day.
Bye, everyone.